Now, ladies and gentlemen, as we meet this morning, the third wave is indeed still upon us. We're still going through very difficult times in terms of the third wave. As of over the last 24 hours, there were 13,777 new cases of COVID, a slight increase compared to the day before, which was 13,263. And in this regard, we remain concerned. It's quite clear that the third wave is taking no different pattern, but very similar pattern to the first and second wave. We know that in this third wave, largely the epicenter has been the province of Gauteng, which at some stage as a province alone reached the heights of 16,000 new infections in 24 hours just as a province. And also that pushed the country to go to levels of 26,000 in 24 hours. So we are very encouraged by the fact that there is a consistent and steady decline in terms of the daily infections. KwaZulu-Natal is also rising, and also in a way, the Eastern Cape is also rising, even though not at a very steep rate like Western Cape. But we're watching this because this is presenting a very similar pattern. And what we were looking at is the fact that we need to work with the province of the Western Cape, make all the tried and tested measures in terms of containment of the infections, make sure that they have the ready bed capacity, all the consumables, the oxygen, and all other necessities to make sure that those who need hospitalization can be looked after. We hope that not so many will need high care and intensive care, but knowing that this will happen, that some, unfortunately, some citizens will end up in high care and even in intensive care. We're working with the province to make sure that this should be ready, but also those who need who are stable but positive, who need isolation and observation in ordinary hospital wards. We're making sure with the province of the Western Cape that this should be ready. But also the question of contact tracing remains very important as part of the containment. So we will be monitoring the situation in the Western Cape, in KZN, and as has been the pattern before, we are worried also that the Eastern Cape may very quickly, in a few weeks' time, start to be engulfed in terms of the surge of the infections.